Certainly the technology is almost essential that we use that today because of the low margins and the high cost of doing business. But we want to remember on these high-risk calves that are coming in that they may not be ready for all of these things. So we want to get those calves healthy first. And that's where working with our nutritionist and judicious use of vaccines, in some cases metaphylactic treatment with antibiotics, we get the calves healthy. And in some cases we even delay the implanting until we get ready to move these calves up on a higher energy diet where they are going to get more corn, because then they'll utilize the implant more effectively, or at least I guess conversely the implant will have a more positive effect on the growth and more positive effect on feed utilization. And so the technology is important, and that's whether it's an aggressive implanting program so that we can, once these calves are healthy, these calves will gain and perform up to an optimal level. And as we get out toward the end of that feeding period, the beta agonists are being used by the overwhelming majority of feed yards now to lay down more protein and to increase carcass weight, and those have shown to be very cost effective. In fact, today it's difficult not to use those if you're feeding cattle in a conventional system. We've mentioned the working relationship with the nutritionist a time or two, and it's so important to getting those calves off to a healthy start. So one thing that the cattle owners and managers may look at is to take some samples of livers. Liver biopsies, for example, are not extremely difficult. Or if an animal dies of an injury and not of disease, or dies of bloat and not of an infectious disease, we can collect a quarter pound of liver, throw it in the freezer, and it'll keep forever to assess the trace mineral status. But in the starting diets that we have that are formulated by the nutritionist, they're going to have adequate trace minerals, but in some cases it may be helpful to put out a loose trace mineral mix for the first 7 to 10 days, providing a little extra so that the calves can start absorbing and replenishing those deficiencies while they're building feed intake. And once they get up to the desired level of dry matter intake, then the ration is going to take care of that. But we have to remember that when we're trying to replenish these trace mineral deficiencies, the deficiency didn't occur overnight, and replenishing the deficiency is not going to occur overnight. So it does take some time, and so during that period of time this calf may be at more risk of developing respiratory disease.